August is Spinal Muscular Atrophy Awareness Month. Doctors say 1 in every 40 people carries the gene that causes SMA.
And a child of 2 gene carriers has a 25% chance of being born with spinal muscular atrophy. Our Olivia Leveda met with the Copperas Cove family using the diagnosis to spread awareness.
Sawyer Clark is just like any typical 10-year-old.
Video games and riding bicycles.
However,
it may have to be an adaptive tricycle so that it can be done. Sawyer was diagnosed with type 3 of spinal muscular atrophy, or SMA. He was diagnosed around 2. It was a genetic test that was done.
So SMA is a group of hereditary diseases where patients will have a difference in their motor neurons, which are in your spinal cord and your brainstem, and they affect how it is that your muscles work.
So Sawyer is not able to walk unassisted. He's not able to run, jump, hop.
My muscles don't work like everyone else.
People across the country are using the month of August to highlight SMA and raise funds for research.
SMA Awareness Month is so huge because now there are so many new opportunities for families with new diagnosed children that weren't available when Sawyer was an infant.
We have 2 medications that are available to treat patients. One is called Spinraza, which works to increase the amount of SMN protein available for a patient, and the other is gene therapy.
And although there isn't a cure right now, Sawyer and his family are hopeful for the future.
Even next year, how more advanced things have gotten and more technologies and more chances and opportunities that these babies have.
I think one of the ways that we can diagnose patients sooner is by doing prenatal genetic testing. So if you're pregnant or thinking about becoming pregnant, you should talk to your OB provider about having SMA carrier screening. Because if we can know that a child is at risk or affected with SMA before they're born, that can allow us to arrange treatment sometimes even as young as 3 days of life. And we know early treatment results in better outcomes.
I hope they find a cure for SMA because I want to jump on the trampoline, I want to run, and I want to do many things that other people can do.
In Copperas Cove, Olivia Leveda, Central Texas News Now.
Well, experts say if your physician has concerns about muscle weakness, delayed motor milestones, or low tone, most patients can receive SMA testing free of charge nationwide.